An advisory has been issued by the Texas Department of Health Services advising doctors to be on the lookout for cases of anthrax.
The first case of the deadly infection has been spotted in a horse in Uvalde County. While extremely rare in humans, the state does want to inform those in high-risk areas who may have been exposed. Unlike the anthrax biological weapon scares of the early 2000s, this is a more natural threat and the result of all this spring's heavy rain.
Since a deer and a horse have died of anthrax already this summer, counties that need to be aware of the physician's advisory are Edwards, Kinney, Maverick, Uvalde, and Valverde. These are all counties where the spores of naturally occurring anthrax have been found in years past.
Closer to Uvalde, there tend to be some cases that pop up periodically, particularly when that weather fluctuates between wet and dry.
Retama Equine Hospital has had little contact with cases since the spores are rarely ever found this far north in Texas. It's passed spore to open cut or ingested or inhaled. The symptoms?
Monitoring for fever is really critical if they think their horse may have been exposed, just to make sure they can have a handle on whether an infection has developed.
The danger of anthrax isn't necessarily from the horses who perhaps come down with it, but from the people who handle the horses.
If you're a ranch hand, it's very common to have an open wound on your arms or your hands. And if you are handling an animal that had been infected, that bacteria could enter through those wounds.
The South Texas Poison Center at the CTRC collects the data from doctors on this infection and others and then sends it on to the CDC. Any sign of human anthrax needs to be reported to your doctor. As for animals, if you come across a carcass,
moving it would be contraindicated. Any disturbance of that body is going to allow spores to be released, and again, they stick around for a long time, so best to leave well enough alone and let the professionals take care of it.
Let the professionals take care of it. Good advice. Anthrax in humans usually looks like an infected sore with a big black scab that grows larger. It is easily treated, though, by doctors. However, you must seek attention because without care, it can be fatal. That said, human cases, again, very rare worldwide, and it's very uncommon in the United States as well. If you want to know more, we've added lots of links on our website. Just look for this story.